A health advocacy group, Civil Society for Malaria Control, Immunization and Nutrition, is worried over the attitude of some health workers in Kwara State to their work. The group is also worried about their attitude to the patients. Correspondent Ibrahim Alege has more on this.
Malaria is a disease caused by a plasmodium parasite transmitted by the bite of infected mosquitoes. It is a preventable and treatable disease. Findings have revealed that though the treatment of malaria is free in Kwara State, activities of some health workers are sabotaging the efforts of the government. After carrying out its investigation in 170 primary health centers in 5 local government areas of Kwara State, the Civil Society for Malaria Control, Immunization and Nutrition says activities of some health workers leave much to be desired.
That if you come for malaria, they will tell you you have to collect this, collect this, collect this. At the end of the day, some patients will be paying over 1,000 naira. I was in a particular facility and they have over 20-something staff, and I was told that they run 9 shifts. But at the time I was there was no 9 shifts.
The artisanal behavior of our health worker is not encouraging. The clients will go to the health facility, and instead of the health worker attending to them immediately, they won't. We find out that they will just like, okay, sit down.
The report of the group was presented before government health officials, religious leaders, and traditional rulers. The aim was to create further awareness and for government to pay more attention to the health of the people.
Virtually all our 16 NGO, we have high prevalence of malaria. Unless these programs in 2017, we have partner on ground. If it's like that, meaning that there's no any malaria intervention in Kwara State. But that's not the issue. People need to be sensitized more.
They are going to start upgrade of many of these primary health facilities. And it's going to start across the state. It's not that they will do one local government. They may not be able to upgrade all the PHCs at once, but at least to give them a kind of facelift.
We are employing all our health workers who are working in all our health facilities in the state, not only where Global Fund is supporting, but to ensure that they change their attitude towards our clients so that they attend to them the way they should attend to them. Health work is more than you just administering drug or giving people injection. It's also about care.
The Association of Civil Society on Malaria, Immunization and Nutrition is a national network of civil society organizations working on the prevention, treatment, and mitigation of impact of malaria and promotion of immunization and better nutrition in Nigeria. Ibrahim Alege, TVC News, Ilorin.
All right now, Ibrahim Alege, our correspondent there, joins me now to bring us up to speed and give us more understanding of this. Ibrahim, it's good to have you join us right now. Can you bring us up to speed? What are some of these specific activities of health workers that these organizations are frowning at this time?
Yes, the organization actually visited 5 local governments, that is Isin, Ifelodun, Irekpodun, Ilorin East, and Moro local governments. And these places are in rural communities. You find out that most of these health workers will not want to report to rural, rural centers. Even if they are posted there, they go there for weeks or at most a month. Then thereafter they return to the state capital. So most of them do not actually, go to the hospitals. Then again, malaria drugs are free. But instead of them selling it for them free, giving it to them free of charge, they would rather, add more other drugs so that they would just ask them to now pay. Instead of telling them that, oh, malaria drug is free, but you need to add this and that. So people will not be aware that they are actually selling some other drugs to them. They will think that government is saying malaria is free, but people as medical officials are still selling these drugs to them. Then apart from that, some of them will say they are running shifts. Some will say they are attending conferences in the state capital, whereas they do not go to hospital, the health facilities are taught in these rural communities. So this is a bit of concern to this group, and they brought this to the ears of the government through the government officials who attended the advocacy meeting. And the officials of government are also saying that they have to work on this. I want to orientate and reorientate the health officials so that there should be a change of attitude. It's a new government and things cannot go on the way it used to be.
Apart from orientation that is regular sometimes and it comes sometimes, are there some recommended consequences to some of these acts?
Yes, what this organization is that there must be consequences. People must be punished for it. Queries would have to be issued. If not, the people will just continue to do it the usual way, that it's a normal thing, that they orientate them, tell them you have to go back to your work and stuff like that. But if no punitive measures are taken, there has to be hard stance on this. If nothing is done in this direction, it will continue as such.